Teenagers struggling to breathe, doctors discovering signs of a devastating and irreversible lung condition known as popcorn lungs. And a warning from one of India's top medical institutions that vaping is not a harmless trend but a growing public health threat among young people. A new review by experts at the PGMIR Chandigarh has raised serious concerns about the impact of vaping on teenagers and young adults. The findings suggest that vaping is linked to lung damage, cardiovascular risks, and nicotine addiction, and even mental health problems, including depression, suicidal thoughts among adolescents. For years, vaping has been marketed globally as a safer, quote-unquote, safer alternative to cigarettes. Sleek advices, candy flavors, and social media promotion have made e-cigarettes increasingly attractive to young users. But doctors now warn that what many believe is harmless water vapor may actually contain nicotine, toxic chemicals, heavy metals, and cancer-causing substances that are inhaled deep into the lungs. The study points to alarming health risks, a higher likelihood of asthma, respiratory diseases, elevated blood pressure, and stroke risk among users. Experts also warn that flavored vapes may expose users to chemicals associated with bronchitis, obliterans, commonly known as popcorn lung, a serious disease that damages the small airways of the lungs. There is another concern. Unlike traditional cigarettes, modern vaping devices are designed to be discreet, making them difficult for parents and teachers to detect. Health experts say many teenagers are being drawn into nicotine addiction without fully understanding the long-term consequences. Well, I'm being joined at this point by Dr. Sonu Goyal, professor with the Department of Community Medicine and School of Public Health, PGIMER, Chandigarh. Thank you very much, Doctor, for joining us. Good evening. You know, the first question that almost instinctively comes to one's mind is, almost all teenagers around seem to be vaping. They believe it's a quote-unquote safer option than what it would be for smoking. What is this popcorn lungs that you're really talking about?
Yeah, thank you for asking this question. First of all, we should know what vape is. Some people call it electronic cigarettes or e-cigarettes. So these are battery-operated devices that actually heats the liquid into some aerosols, which are inhaled by users. So these are aerosols, not the water vapors. So people usually confuse themselves that we are just having the water vapor, but these are aerosol which contains very harmful chemicals like propylene glycerol, glycerin, nicotine, and they are very harmful for our lungs. So I think this is what vaping is, and as you rightly pointed out that it's contains lot many chemicals, ultra fine chemicals, and all these things are carcinogenic. So most of the chemicals which I was talking about are carcinogenic, and they actually are much higher than what cigarettes are. Like, for example, I'm taking the example of nicotine. So nicotine is far high in nicotine in cigarettes. It is just 1 to 2%. It reaches to 7 to 8%, but in e-cigarettes it sometimes is up to 80-90%. And nicotine is considered as the poison under Poisons Act. So, and people have died just by inhaling or just by ingestion of nicotine. Besides it, I think there are other chemicals like zinc, which is again carcinogenic if it is taken. So it is 30 times higher than cigarette smoke. So these are, I think, and besides this, I'm just talking of 2 or 3 chemicals, but most of the chemicals, heavy metals and all, are very high in electronic cigarettes. So they are not at all harm reduction device, which people usually tells about.
You know, you spoke about popcorn lungs. What is this popcorn lungs?
Yeah, it's a very interesting disease, actually. So this is, I think most of the audience have seen the popcorns. So popcorns are like, they are bigger, like it looks like the 3 or 4 things are joined together into it. So what happens actually when people inhales or vape e-cigarettes, so it goes into the deeper part of the lung, and they damage the alveoli. What is the alveoli? Alveoli are small pouches which are there inside our lungs, which actually help in breathing and which actually helps in oxygenation. So it gives, when we breathe, the oxygen which we breathe are transferred to blood vessels. So that is what is actually happening. But when somebody breathes or take vaping, so these alveoli are coalesced each other, like they are joined to each other, so that to decrease the surface area. And if we decrease the surface area, the oxygenation doesn't happen. The oxygenation of, so our brain, our git system doesn't have that much of oxygen which they require. So so this is called popcorn lung. And there is another interesting disease which is linked to e-cigarette, because you are talking about popcorn lung. There is another disease known as EVALI, which is e-cigarette or vaping associated lung injury. So this is purely due to electronic cigarette, and it has become a health concern. If you remember it during COVID times when our lungs were already compromised. So during COVID, so what happened is that people who are vaping, they're sitting inside, they're vaping, and especially the young. So they developed this EVALI. So EVALI is basically like constant coughing, chest pain, shortness of breath, fever, nausea. And what is happening is, again, it is many deaths have taken place due to this EVALI. And right now, at that point of time, 68 death has occurred, but there are around 2,800 deaths which have been reported just due to this EVALI, that is e-cigarette or vaping product use associated lung injury. So these are
So,
the two common illnesses.
so Doc, how is the correlation between teenage vaping and popcorn lungs, or these deaths due to E-Valley that you're also talking about? How have you come about with this number of in correlation to teenagers? Because that's very specific that you're really talking about. And I haven't come across any study in terms of Indian context, particularly Indian teenagers. So tell us, how has this come about? What are your findings in this?
Yeah, so I think this most of these diseases are right now common in US, UK, where they have not regulated or banned electronic cigarettes. So it was present since 2000, I think 2008, 9 in US, and it has proliferated to such an extent that it is causing a lot of injury to their teenagers. But Indian government was proactive enough, and in India, it came somewhere around 2012, 2013. Punjab was the first state which banned electronic cigarette. Very bold decision by Punjab, which was taken. And thereafter, taking cue from Punjab, many states have actually banned, not even regulated, e-cigarette. And in 2019, Government of India, through the ordinance, they banned electronic cigarette. So due to this ban of electronic cigarette, it is not very freely available as it is there in US and UK. So we are not finding those type of popcorn lung related or evaluate related cases, very frankly. Second is because it has come lately, like around 6 7 years later than US. So we might find the cases later on. So there might be a chances, because e-cigarette has not come to that extent.
Right.
So we might find later on these type of diseases.
So, the study also very clearly indicates that vaping is on the rise among teenagers. Is the fact that the impact of vaping takes a considerably longer time as well, and therefore data and the sample studies are harder to find. But globally, this is an increasing risk.
Yeah. So I think you're right that it sometimes takes time. Even cigarette, like when we thought about harmful effects of cigarette, it came in 1960s. But it's all these harms of cigarettes and like products came somewhere around 75, 90, 75, 80. So after 15 years, 40, 15 years or so. So similarly, I think we might find the data if we don't ban the cigarette, if we don't implement that ban. So we might find, and there has been studies, and we have done an umbrella review. Umbrella review actually is a combination of all the systematic reviews, and all systematic reviews combination of all the studies done till date. So it's a highest level of evidence, and we have done just in 2025 analysis of 69 scientific review, and each review has many studies to it. And we found that all the serious diseases affecting lung, heart, mental health is associated with vaping. And we have found that asthma, there is a 30% higher risk of a person suffering from asthma, and 49% higher risk of suffering from chronic obstructive pulmonary disease, which are common diseases actually, and 52% higher risk of brain attacks or stroke, so which people like everyone knows. So, and besides this, increased heart rate, blood pressure, reduced lung function, suicidal thoughts, mental disorders are also very common
This
among
is
it.
what I want to come next to, and it's very alarming. It's very concerning that your study also talks about suicidal thoughts and mental health issues in direct connection with vaping. Again, something that I have not come across with all the studies that I have been following. But in this context, explain this to us. Because usually speaking, it's when you have a lot of pressure, when you want a break out of something, when you want to relieve the stress, then you would take to vape. Like any other, substance that one would resort to, or addiction one would resort to. So how is this connection between vaping and mental health, particularly depression and suicidal thoughts?
So for that, one need to understand the pathophysiology of this vaping. So what happens? So I told you that vaping is almost like 90-95% nicotine. So when you vape or when you inhale the nicotine from the device, in just 7 seconds it reaches the brain. It's very fast. It reaches in 7 seconds to the brain, and it attaches itself to many receptors over there. And there has been studies on this, that initially there has been some excitement and there has been some elation, like happiness, and all those things are there. But later on, all these things have led to the suicidal thoughts and depression. So it's an initial feeling which people feel that I am relaxed and all those things, but later on it has led to depression and severe mental disorders. Not only depression, but severe mental disorders have been seen in the vapors.
Last question, Doc. Is there any specific reason that you chose to do the study among teenagers?
Yeah, actually, I found that that it's a very fast proliferating disease. I must say, it's a disease, and if we don't stop it right now, in next 30-40 years, we might find a huge thing, and then it's very difficult to stop at that point of time. So I thought of conducting this umbrella review, which is the highest level of evidence, collating all the studies, because some studies are going in different directions because of tobacco industry sponsored thing. So then I tried to collate them, and I found a very clear evidence on the risk which I was talking about. So that was the main aim why I chose to choose this area and do the study on this.
Thank you very much, Doc, for this conversation. I think a very eye-opening conversation. I don't know how many teenagers we can inspire, how many teenagers to really get off the vaping culture, the vaping bandwagon as it was, but as is our job, getting them more aware and equipped is perhaps the best that we can do. Thank you so much, Dr. Goel, for joining us.
Thank you very much.